Is urticaria limited to the skin?
In most patients, yes. So it is clear, every patient with chronic urticaria has skin signs and symptoms. Some patients have other problems. Their joints ache, they have headaches, some patients have discomfort. So yes, it can happen that in addition to the skin problems, you have other problems. That's not very common, but it happens and should be checked out. Why? There are other diseases that look like urticaria. The skin looks the same, you have wheals, you have angioedema, but they're not urticaria. And some of these diseases come with severe other problems. So that should be checked out in patients who have, for example, joint ache or recurrent fever. Usually, normal chronic urticaria is a skin condition with very few systemic signs and symptoms.
Some patients have wheals for days and days. Can this cause problems?
Well, of course. Imagine wheals for days and days. They don't go away. They itch all the time. You scratch them. You take your medication. They're still there. Yes, that can cause problems. You get annoyed. You get irritable. This is bad. It's not dangerous in that this means that it's something else than urticaria. It's just the way some patients react. The one thing that you should look for or look out for is that if the wheals are there for longer than 24 hours, one should exclude that the wheals belong to urticaria vasculitis, which is a different disease, looks like urticaria, but is very different than urticaria.
Many patients report that the wheals wander slowly over the skin. Is this normal?
Yeah, this is in a way normal. No, in the mornings you have a couple of wheals on the belly and then they go away, but they appear on the shoulder. And so this is why it looks like they're wandering, like they're migrating across the skin, but of course they're not. They're coming at one side, then they go away at this side, and in the meantime or shortly after that they appear at another side. What's interesting, and this may be something that you have noticed as well, is that the skin, the area of the skin that has reacted with wheals is somewhat protected for a day or 2 days to develop new wheals because the cells at that skin site cannot react for this time before they produce more of these mediators that make the itch. So yeah, they wander. But not really. They come and go, and that's the